Parents often hear the advice, don't let them sleep after a head injury, but that's not always correct. In this video, I'll explain when it's safe to let a child sleep, when it isn't, and what signs mean you need urgent help. Children bump their heads all the time, learning to walk, running, climbing. After a knock, they may cry, settle, and then want to sleep. That's where parents worry, is it safe or dangerous? The key is knowing the difference between normal sleep and dangerous drowsiness. The short answer is yes, a child can sleep after a head injury, but only if they are otherwise well and behaving normally. Sleeping itself isn't dangerous, the danger is not being able to wake them. It's usually safe to let a child sleep if they are alert, responsive, and behaving as they normally would. They may be tired, but they should be able to talk to you, recognize you, and respond appropriately. A brief cry followed by settling is common. If the child sleeps, you must check them regularly. Make sure you can wake them. They should stir, move, open their eyes, or respond to your voice or touch. A child who objects to being woken is actually reassuring. This is critical. Normal sleep means the child can be woken. Drowsiness means they are hard or impossible to wake, and that is an emergency. If you can't wake the child, call 999 immediately. Call an ambulance immediately if the child becomes very drowsy, vomits more than once, has a seizure, seems confused, or has blood or clear fluid coming from the nose or ears. These are signs of a serious head injury. For a minor bump, sit the child down, reassure them, and apply a cold compress wrapped in a cloth. Paracetamol can be used for pain if needed. Encourage rest and avoid rough play. Children should be monitored closely for 24 to 48 hours after a head injury. Some symptoms don't appear straight away. If something doesn't feel right, trust your instincts and seek medical advice. We don't keep children awake to prevent brain injury. We allow them to sleep, but we observe them carefully. Being unable to wake a child is the danger, not sleep itself. To summarize, yes, you can let a child sleep after a head bump if they are well and can be woken. If you're worried at any point, seek medical help. When it comes to children and head injuries, it's always better to be cautious. If you care for infants or children, knowing first aid can save a life. Subscribe with Dynamo Training Solutions for more pediatric first aid guidance, or check out our full pediatric first aid course.